Greetings. Got a video here. This one's going to be about parasites and the effects that they have in the body. And I'm starting off with a clip from, well, this is an interviewer here, but he's referring to Dr. Holder Clark, who was a holistic practitioner, and she tested all her patients for parasites. And what she always found, he's going to say right here. Okay. So one thing that's recommended, I think the age is from around 45 years old, 45 years of age. It is recommended in the United States to have a colonoscopy screening, right? Oh, that is right there. Most people should begin screening for colorectal cancer soon after turning 45. So during a colonoscopy, where the doctor will sedate you and insert a flexible camera inside of the rectum to penetrate deeper into the colon. And what they're looking for, here we go. What they're looking for are polyps. So here, overview, a screening test is used to look for a disease when a person doesn't have symptoms. Colorectal cancer almost always develops from precancerous polyps. Here, precancerous polyps. There are abnormal growths in the colon or rectum. Screening tests can find precancerous polyps so that they can be removed before they turn into cancer. Okay, so if polyps turn into cancer, then what are the polyps and what causes the polyps? So here, and this is blow this up for you, an official website of the United States government. This is the NIH, National Institute of Health. This is on their website. And what it says here about, this is from 2020, or I'm sorry, 2020. Colonic polyps, an unusual manifestation of schistosomiasis. This schistosomiasis, breaking the word down, this iasis is condition of, and so it's condition of schistosoma, which is a parasite. Okay, so it's clearly saying here that colonic polyps, an unusual manifestation of this parasite condition. Symptom, abdominal pain, bleeding from rectum. See here, they list the medication. During a procedure, xylocaine local gel. I don't believe this was done in the United States. But here in the United States, they use a lubricant, a different lubricant. And for the past 11 years, 15 plus different hospitals I've gone to, all of the lubricants have parabens in it. Parabens are hormone disruptors, and they also can cause cancer. So they're reporting a case of a large rectal polyp as a manifestation of chronic intestinal bilharzia. That's another Parasite. It's a 24-year-old male patient born in North Yemen, worked as a military soldier. Complaint concerning intermittent lower abdominal pain and several months of rectal bleeding. They located a 10 centimeter, where is it? Two large rectal polyps measuring 4 by 3 centimeters and 2 by 3 centimeters. Located 10 centimeters from the anal verge. The conclusion, they said, it's very difficult and challenging to differentiate schistosoma-induced colonic polyps from other colonic polyps, even with an endoscopic evaluation. Thus, a high index of clinical suspicion is required mainly in an endemic area, which may prevent the physician from ordering unnecessary interventions. So instead of ordering, being that they now see these polyps, they might order surgery to remove the polyps after they've biopsied the polyps and send it to pathology, which is unnecessary, being that is actually a parasitic infection. Now, when doctors when they're performing this colonoscopy and they see the polyps, like I said, they'll basically bite it and rip a little piece off, and sometimes they'll rip quite a few pieces off, and they send it to pathology. So, what is the polyp? The polyp consists of a combination of a vascular neoformation. Neo means new, so a new vascular formation, and an inflammatory reaction to parasite eggs. Worm can be found either dead or alive inside the polyp tissue. Now, I work in surgery. I'm a surgical technologist, and I've been in these procedures, and I've seen these parasite eggs like all through the colon. And I asked the question to at least 5 different physicians. Hey, doc, what are those round, oval, white things? And one of them replied, I don't know, food or something. It's like, come on, man. So, anyways, polyps contain parasite eggs, but the medical association, the practices, and what they tell us is that, hey, this is precancerous. So then what really is cancer, right? So this is some information on a different disease caused by parasitic infection. As Dr. Holder Clark said, all diseases are a combination of a parasite and a pollutant. I'm not discussing any of the pollutants today. I'm discussing parasites and conditions. So this here is basically, this is gallstones. Cholecysto, that's the gallbladder. Lith refers to stone. Isis condition. Gallbladder stone condition is associated with Clonorchis sinensis infection. It's a parasite. I have participated in hundreds of these procedures. I've seen stones plenty of times. Not once have I heard the doctor ever mention a parasite. The objective of this study was to analyze gallbladder stones for direct evidence of a relationship between Clonorchis sinensis infection and gallbladder stone formation. The 183 gallbladder stones for the presence of Clonorchis sinensis eggs using using a microscope, and analyzed their composition using Fourier transform infrared spectroscopy. We confirmed the presence of Clonorchis sinensis eggs in the gallbladder stones using real-time fluorescent, PCR, and scanning electron microscopy. So out of 183 stones, they found eggs in 122 of them. It's a direct conclusion. Clonorchis sinensis eggs were detected in the gallbladder stones, which suggests an association between Clonorchis sinensis infection and gallbladder stones formation, especially pigment stones. Yeah, so it's a direct association. Okay. So this is what the instrument looks like. If you can see this, this is a blade right here, and the blade penetrates the intestine, and then these jaws close, and then the doctor pulls, a little yanking motion, boop, yanks a little piece off, and I would pull it out. And once I get it in my hands, I will open this up again and shake it in a little cup that's going off to the laboratory. Oh, so this is get to the top of the page here. American Cancer Society. This is what they say about can getting a biopsy. Oh, that's what I want to say. So once the doctor sees this polyp, right? They don't look like a polyp. The polyp, like I said, they bite inside of it. They tear little pieces off, and there's parasites inside. So what's going to happen once you just open this thing up? The same thing that would happen if you open up a beehive. If you poke some holes in a beehive, you need to be ready for those bees. Okay, so once they do the biopsy and parasites spread out of there, they don't tell you that it's parasites. Example: I know someone who had no symptoms of illness, very healthy, very active, always full of energy. This person had a colonoscopy. They saw, I don't know, 10 polyps, I believe. They took 8 biopsies. And later, I think pretty soon after, he was diagnosed with prostatitis, which is inflammation of the prostate. Sometime after that, I don't know how long, I don't know what the time frame was, but then they told him, "Oh, you have a prostate cancer," you know. So it all started with the colonoscopy and the biopsy that they're doing. So the question is being answered here, and they're not truthful. They admit some of it. This is what they say regarding, do biopsies make cancer spread? While cancer spread after biopsy can technically happen, it's important to remember that it's extremely rare. So they say. When it does happen, it's called tumor seeding. This process that occurs when the needle inserted into a tumor during the biopsy dislodges and spreads cancer cells. Tumor seeding may also be referred to as needle tract seeding because the cancer cells grow along the needle's track. So this is saying it right there. Knowing that it's parasites, that they're calling cancer, um, the cancer grows right where the needle, right where the needle was. Like, you know what I'm saying? Um, and they're saying, okay, yeah, it happens, but it's really rare. They say this 2008 study revealed that needle track seeding. Here, let me reword that. Cancer spreading through biopsy occurred in just 2.7% of liver cancer biopsies. This is what they're saying. It doesn't really get reported often. This is what, I don't know if this is really what they know, but this is what they're reporting. The fact that they're not saying it's parasites, they're already lying. But anywho, 2015 study, researchers reviewed previous studies and found that the incidence of needle track seeding was less than 1%. Okay, even less than 1%. Let's say that this is 100% true, right? But so now take my friend, for example, who didn't have any disease. He went because he was, over 70 years old, because they tell us we should be getting checked. So less than 1%, it still increases the chance. You know, it still makes the chance of developing what they call in cancer greater by doing this procedure. 2019 study followed 42 patients with bladder cancer who had a core needle biopsy. After following them for 28 months, no tumor seeding was found or reported. Is that part? It wasn't reported. It wasn't reported. Anyways, I don't want to spend a lot of time on this. If you want to look this up, you can type this here. Oh, it's a little out of order. This slide here. I was says this is more about parasites and gallbladder health. Understanding the link between parasites and gallbladder issues. So, like football great Randy Moss. Randy Moss has, they say he's cancer free now, but Randy Moss had cancer of the bile duct, right? And he had surgery, and they said he has a clean bill of health. The thing is, they're doing nothing for the eggs. So from what they see or don't see, they're saying he's parasite free or cancer free. Oh, and guess I'll do this one for you. Diabetes. I'm just going to touch this one really quick. So, since learning from Dr. Holder Clark that all diseases are caused by parasite and pollutant, every time I've looked up a parasite with the disease, I've found it every single time. So diabetes is a big thing here in the United States. Co-occurrence of opisthochiasis and diabetes exacerbates look at that. These disease manifestations indicated that opisthochiasis during diabetes exacerbated hepatobiliary disease. And the hepatobiliary cancer is what Randy Moss had. And it's caused by a liver fluke. So HPV. HPV is an infection caused by a DNA virus from the papillomaviridae family, meaning HPV infections cause no symptoms. Sometimes an HPV infection persists and results in warts or precancerous lesions. That's what I was looking for. Oh, so precancerous. So then HPV can cause cancer. So then my question is, what causes HPV? And I don't have the slide. Certain parasitic infections, particularly those caused by helminths like schistosoma, hematobium, and hookworms, have been linked to an increased risk of HPV infection and cervical cancer. So every disease that we have looked up so far, you can see the parasite. Um, what's common among them all? The parasite is common. So also, high blood pressure is a big thing, is a common thing here in the United States, and that's also parasite related. Now, also there can be chemicals and stress that can lead to high blood pressure, but for typically healthy individuals, um, or otherwise healthy individuals, I would say to do a parasite cleanse. So here it says Chagas disease caused by the parasite Trypanosoma cruzi has a documented association with hypertension, significantly contributing to high blood pressure in affected individuals. Okay. Here they're talking about intestinal parasites and diabetes. I mean, there's, like I said, there's also a parasite in the liver that causes diabetes. Oh, got the paraben information. So, like I said, there's parabens in the lubricant, and here's a little information on it. Chronic exposure to low levels of parabens increases mammary breast cancer growth and metastasis in mice. Okay. Methylparaben and propylparaben are commonly used as food, cosmetic, and drug preservatives. And it just said right here in the heading that even chronic exposure to low levels causes cancer growth, breast cancer growth, and it's spreading metastasis in mice. The reason that they even test mice and different animals, bats, monkeys, because they'll have very similar reactions to humans. If you give them just a little bit of something and they die immediately, it's probably going to kill us too. We maybe a little bit more than what was used to kill the animal or to injure the animal. So any gynecological exam. You see your women see their gynecologist at least once a year. When they put that lubricant and stick that finger in there, they're giving you a low dose. So this is what they call in a chronic. Let me get this right here. Chronic exposure to low levels of parabens. In the mice, they gave the mice 20 treatments, and they saw these paraben exposed mice had increased mammary tumor volume compared with control mice, and a 28% and 91% increase in the number of pulmonary, that's lung cancer per week compared with the control mice, which didn't get cancer. 0.00, what is that? Yeah, I can tell you the number. So read your ingredients list, and you see parabens on there, leave it alone. So what to do about it? What to do about the parasites? What to do about health issues that you may not know is coming from parasites? Do a parasite cleanse. This is sold by the family, I believe, of Dr. Holder Clark. She left this for them, and I think it's great. I appreciate her study and what she shared. So, what is in what the cleanse is? This parasite cleanse is cloves, which come in pills. Green, so it's black walnut whole tincture, but they used they used it. It was harvested and tinctured while the black walnut whole was still green, because it has a plant chemical called juglone that is 10 times more potent when green than when it turns brown to black. And the third herb is wormwood, which they call their pills Super W blend. Okay. Got a couple of things out of order here. So this is. So this is, when you buy this cleanse, it will come with instructions, but I will go over it briefly here. The cleanse is 18-day. And oops. This is how this works. Black walnut whole tincture. Oh, I didn't think they sold the capsules anymore. I never saw them until today, actually. But depending which one you buy, they tell you how to do it here. So they'll tell you here, take once a day on an empty stomach, at least 13 minutes before a meal. You can go 20 minutes, 30 if you must, but they say 13, at least 13. I say 13 to 20. Tincture, you put drops in a half cup of water. Capsules, open one capsule to get pinches of powder. Huh? Actually, never read that part right there. Open one capsule to get pinches of powder. Take with water. Okay, so here's if you get the tincture, day 1. The days are here. Goes all the way to 18. All right. Day 1, 1 drop of tincture, or 1 pinch of powder, if that's how. If so, 1 pinch of powder would be from 1 pill. You know what? They won't tell you just take the pill. And you'll also take 1 capsule of the Super W blend, which is the wormwood. Take once a day on an empty stomach, at least 13 minutes before a meal or with the meal if you have a sensitive stomach. And then also the cloves you're going to take 3 times a day. Okay. So 1 capsule 3 times a day. So for day one, this is what you can take all at one time. 1 drop of tincture or the one pill, which is a pinch of powder, the 1 capsule of wormwood, and then take 1 capsule of clove. Do that in the morning, and then 2 more times in that day. You're finished with these two. You're finished with the black walnut and the wormwood, and then you would take the clove pill 2 more times that day. It increases a little bit on day 2. 2 drops of tincture or 2 pills, 1 capsule of the wormwood, and 2 capsules of clove 3 times a day. Okay, and it just keeps going. So, and this will come. These instructions comes in the Parasite Cleanse Kit. So important. What's important to know is after the first 6 days of being on the cleanse, after you get up to the 2 teaspoons of tincture or 5 capsules, you will stop. You will stop taking the tincture until day 12. Meanwhile, you're still going to take these. You're still going to take the wormwood, and you're still going to take the clove. So then in the morning, you start with 3 capsules of wormwood, and then 3 capsules of clove. And then you'll take 3 capsules 2 more times that day of clove. Then the next day, 4 capsules of wormwood. And it goes like this until day 13. Now you're going to take 2 teaspoons of tincture of the black walnut tincture again. Okay. And you won't do it again for a bit here. Okay. So then what is also recommended, and all of this it comes in a printout with the Parasite cleanse. After the 18-day cleanse, it is strongly suggested that you do a maintenance, which is, say for the maintenance, you should do 2 teaspoons of tincture, 7 capsules of the wormwood, take all of them together, and 7 capsules of the cloves. You can take all of those together. You can do all of this at one time in the morning, and you're done for the week for maintenance. Now, one thing that's important is because the parasites are active at night. They're more active at night, and when you're cleansing, it can keep you awake. So she sells, or her family sells, ornithine. Now, this is something lab created. This isn't totally 100% natural item, natural product. So that's your choice if you want to do it that way. Or for someone who really isn't on any medication, I would say buy some valerian root. Stay away from the melatonin, unless you like that and that's what you take all the time. But I wouldn't do the melatonin. I'm not sure that I would do the ornithine either. But for some people, they have to get sleep to proceed with their day. And for the short time, I was looking it up. I didn't really find anything harmful with the ornithine. I didn't find anything. And then also what's recommended is a Parasite Cleanse high dose program. But this is every 2 to 3 months in place of the maintenance. So recap on this: 18-day cleanse. After the 18-day cleanse is over, 7 days after that, take all of the dose for the maintenance. And your choice, 2 to 3 months of taking the maintenance program for once a week, then you would do this. Okay. You would do, actually haven't read this one yet. So week 1, 30 drops 2 times a day. Take tincture twice. Oh, wow. Oh, that is high dose. Okay. Yeah. So 2 to 3 times every 2 to 3 months, it says high dose, but everything is laid out here. A couple other things. Oh, yeah. So this is zeolite. Zeolite, zeolite forms when volcanic lava hits the ocean water. The charge that it has will bind. It binds to heavy metals, and it will clean up. It will also bind to the parasite waste. So when parasites die, they leave behind an ammonia-like chemical. They pee, poop, and when too many of those die at one time, if it's not carried out of the body, it can make you feel sick. It can make you feel like you have the flu. So don't forget to get this. I would do this. I like this brand. It you mix it in water, and it absorbs like really, really easily in water, and has no taste. And I wanted to touch on antibiotics real quick. Really quick, actually. Really, really quick. Antibiotic induced immunosuppression. What this is saying is antibiotics basically wipes out your immune system, is what it's saying. Or presses down, it lowers the immune system. And it does this because it kills the good bacteria in the gut that makes up 60% of the immune system. So I've seen it when people take antibiotics, they'll feel fine initially. In some cases, they'll feel really good initially, but within 6 weeks, maybe a little bit more, some sort of infection presents itself, and it's kind of difficult. Person feels miserable. I say don't go to antibiotics. Okay. Hopefully this video wasn't too long. I don't know the count here, but I am done. Please comment, like the video. Got any questions? Let me know. Peace. Love you.